like to welcome you to Tapping for Trauma. This video is part of a series entitled Resources for Resilience. My name is Dr. Kimberly Flemke, and I'm a licensed marriage and family therapist in Philadelphia, Pennsylvania. Like you, I'm feeling very concerned about the violence, terrorism, and natural disasters that are happening within our country and also around the world. This video has been designed to teach people tools to adapt more easily and more flexibly to stressful events. As we begin, it is important for everyone to understand that when violence, disasters, and other horrible events happen, it is normal for people to have a number of reactions, and these may range from not being able to get the event out of your mind to having emotional reactions such as stress, anxiety, worry, maybe sadness, maybe grief, sometimes agitation and anger. Sometimes people feel numb and totally disconnected, and other times people have reactions more in their mind or even their body. It is also a very common reaction to become upset and judgmental with oneself about having these types of reactions. People often are very self-critical or feel really ashamed, thinking that these types of responses are not normal. But just know that no reaction is right or wrong. It's just simply a signal that something painful is being felt inside, and it's inviting you to look inward and help heal it. So everything that we are about to show you will work much better when you are more accepting and gentle with yourself. One image that many people find helpful is to think of difficult emotions and reactions like water in a river. You don't want to dam the river. You want to let the water just flow past you. In fact, the self-help tool that I'm about to show you involves tapping on acupuncture points along the body. There has been a lot of research that shows this approach can be very helpful. You might wonder why this would be so, and the answer is that it is normal for negative reactions to happen after a traumatic event. But it is also common for these reactions to become stuck in the body. And if you think about it, isn't that what it feels like? You want the feelings and the reactions just to move past you, but they don't. They stay stuck inside and keep getting triggered and activated. So stimulating acupuncture points with tapping helps that energy to become unstuck and move through and out of the body, which will allow you to feel far more centered and calm. A few more points before we begin. You're going to learn a self-help approach to help you process the stressful events that have happened. It is also really important that you try to manage the amount of stimulation you're taking in, such as turning off the TV and radio if they keep replaying the event that has triggered you, or at least try to severely limit it. And I also encourage people to try to connect with friends and family, people that support you, and also maybe engage even in the activities you used to enjoy to help you connect with what is still good in the world, even in the face of such tragic events. So with that in mind, let's begin. First, I'm going to ask you to really go inward and see what is the primary emotion that you are struggling with right now. And on a scale of 1 to 10, I'd like you to rank it in intensity. 1 not at all, 10 the most you could feel it. Jot it down if you think you'll forget, or just remember the number. And now I'm going to show you the places we're going to tap. So I'm going to invite you to tap where I am tapping and repeat what I am saying, okay? So the first place we're going to tap is right here. It's called the karate chop point. Then we're going to do the inside of the brow, the side of the eye, gently on the bone beneath the eye, under the nose, the crease of the chin, right here on your, right beneath the collarbone. Here's your armpit, go 6 inches down. It's between 2 ribs, you'll know it because it's tender, rub between there. And then we'll end on the crown, okay? All right, so here we go. I'm gonna do a couple rounds to activate the emotion, and then we'll do a few rounds to help release it. So even though I am full of anxiety and stress right now, please repeat that. Good. I deeply and completely love and accept myself. Good. Even though I feel really overwhelmed inside, I know I'm doing the best that I can. Even though I feel really anxious, I am trying to love all of me anyway. Good. Inside of the brow, I am so overwhelmed inside. I feel so much stress and tension. I feel like I'm going to cry. I really am having trouble breathing. My heart is hurting so deeply. I'm scared. 6 inches down. I feel really helpless inside. Top of the crown. I feel really overwhelmed. There's so much anxiety and so much stress. My body feels so tight. I feel really anxious inside. I am really overwhelmed. I so want to release some of this pain. I hate feeling this way. I really want to feel calmer inside of the brow. So maybe today I'm ready to release some of the pain. Maybe I'll start to be able to breathe deeper again. I invite feeling calmer inside. I really want to feel more peace inside. I love when I can feel more relaxed. I really want to feel calmer again. 6 inches down. I welcome feeling more centered inside. I'm ready to release this stress. I want to release this anxiety. I want to envision this tension leaving my body. I want to sleep peacefully again. I'm ready to feel calmer inside. I think I'm ready to try to release this pain. I really want to feel like my old self again. I think I'm ready to release some of this. I think today is going to be a turning point for me where I can breathe deeper and feel better again. Okay, good. Now take a deep breath. Release. So thank you for joining me. I hope that helped. And now I would ask you to please go inward, scan your body again, and check in with that emotion that you rated in the beginning on a scale of 1 to 10. And I hope it dropped some. You are welcome to replay this video and tap as many times as it feels helpful. I wish you much love and many blessings on your journey to healing, wholeness, and well-being. Take care.